Dr. Eyolfson, you're up. 4 minutes.
All right. Thank you, Mr. Chair. Mr. Edwards, you made a comment that I thought was very good. You said how, in regards to what's safe, we should be asking doctors rather than lawyers. Being a doctor, I might be a little biased, but, on that I would agree. Now, first of all, you said the statement, and I've heard this said before, that vaping is 95% less harmful than smoking. Where does that number come from? Does that come from a medical journal? Does that come from any peer-reviewed scientific research?
It's, from what I understand, it's peer-reviewed scientific research done by the Royal College of Physicians in 2016, and they state that vaping is likely at least 95% less harmful and or toxic than smoking a cigarette. And they recently, Public Health England, last week on February the 6th, did a review on the success and the progress of their liberal, open-minded approach to vaping and harm reduction in their country.
I have limited time, so I'm going to go on. Now, if you could provide those references for us, that would be very useful. Thank you. Now, in regards to another statement that you made, you talked about how this shouldn't be in the same bill as smoking. It's nothing like smoking. We should draft this, take vaping completely out of this legislation, put it somewhere else because it's just not similar. Now, as per your own suggestion, listening to the doctors, from the Canadian Medical Association Journal, 2 separate studies. One finding that smoking or vaping among young people is at rates slightly either at or higher. These are people who try it for the first time. The young people are now vaping at rates slightly higher than those who are starting smoking cigarettes. This is from the Canadian Medical Association Journal. And another one, and this is very recent, this is October of 2017. It's a very large study that shows that those who start vaping are significantly more likely to then move on to smoking tobacco. So in other words, young people are using it at the same or higher rates than smokers, or higher rates than tobacco, and they're much more likely to go to tobacco if they start vaping. So how does that fit with your assumption that, or your assertion that vaping has no part in this legislation?
Well, first of all, vaping has not been legislated yet in Canada, but it has been, the UK has 10 years on us and more. We should be looking to the United Kingdom and their program and templates, which has proven to be successful. And you stated your report was from October 2016, if I'm not mistaken. Pardon me? 2017. Well, we just had a new review and by Public Health England in a country that has actually applied the vaping regulations and with a liberal, open-minded approach. And they say the evidence does not support the concern that e-cigarettes are a gateway into smoking among young people.
Okay, so, I understand that, but since we're drafting laws in Canada, should we not be relying on the evidence that is collected in Canada?
If I may, you might be referring to a study authored by David Hammond from the University of Waterloo.
Yes.
And his own, contrary to the headlines that were published, his own conclusion is that vaping, that there is a correlation but not a causation. They cannot prove a causation. And his leading hypothesis is that kids who try stuff. So all the data to date shows a displacement of smoking by vaping rather than a gateway effect. And the largest longitudinal study of 60,000 participants in England has shown a reverse effect. It completely dispelled that myth.
All right, thank you. Again, would there not be confounding factors between two countries? They're not the same society at all? Are there not?
There are similarities.
Confounding variables?
Yeah, thank you. There are similarities, and we do have additional information from University of Victoria supporting that hypothesis, and I'll be happy to follow up with a written submission to that effect.
But also, there are public health clinicians like yourself who support the theory that vaping is magnitude safer. They may not put a percentage to it, but magnitude safer.
All right, thank you very much.
Time's up. Now, team, we have